While hospitalizations and deaths from COVID-19 increase across the region, thousands are also recovering from the virus. News Channel 11's Kaylin Cluck asked Ballad's Chief Infection Prevention Officer what protocols that those who have already had COVID-19 should follow.
If your COVID-19 test results come back positive, you may wonder what to do next, especially if you're recovering at home. Jamie Swift, Chief Infection Prevention Officer for Ballad Health, says you need to isolate for 10 days after the onset of symptoms and notify your close contacts. There's no special diet you need to follow, but make sure to get plenty of liquids.
When I talk to patients, it's really about staying home, staying hydrated, and what you don't want to happen is to have dehydration on top of not feeling well.
But what about when those 10 days of isolation are up?
If you're symptom-free, you come out of isolation. What we don't want people to do is you don't need to be retested. We know that for the most part, you're probably still going to test positive on that PCR. It does not mean you're infectious.
Swift said CDC guidance says you're most infectious 2 days before the onset of symptoms to 5 days after.
The most people, the majority of people can go with the 10 days. At the end of 10 days, then you can come out of isolation.
After that, Swift confirmed there is a period of time where you likely don't have to worry about being infected with COVID-19 again.
But right now, everything seems to indicate that you most likely will not get reinfected with COVID for up to 3 months. It may be longer. We just don't know yet.
With many recovering from coronavirus just in time for the holidays, Swift said those people are still asked to wear masks and use caution when it comes to gatherings.
I don't think those will be the guidelines forever, but it's kind of like with the vaccination. There's a lot of things we need to understand before we do a blanket change of guidelines.
Kaylin Cluck, News Channel 11.